Yes. Okay, so what's the importance of patient-centered care in Africa from as a nursing student? Okay, so the concept of patient-centered care is not a strange one, as we are being taught and trained in schools. But in disparity, there's a wide gap between what we are being taught and what is really being practiced in the clinical world. So as nursing students, I feel the significance of patient-centered care should be centered. So because we as nursing students, we play a strategic role to delivering care that is really patient-centered. So if you're going to deliver a patient-centered care, it has to be culturally congruent to the needs of the patient. It has to emphasize on each needs of the patient, the preferences of the patient, respect for the patient as unique beings. So as a nursing student, you realize that because we spend most times with this patient, so we are strategically positioned. So one of the importance that we should also think about is ensuring that the patient care is strategic, patient care is encompassing, it is holistic. You're not just looking at the patient from the clinical perspective, you're looking at the patient holistically. It is not just about my role as a nurse, neither is it just about the role as a doctor, neither is it just about the pharmacist. It is an encompassing thing. So one of the major significances is that we cannot is the effect of interprofessional collaboration, because we cannot really be talking about patient-centered care without emphasizing on interprofessional collaboration. So that is one of the reasons I'm grateful for this kind of webinar and for this kind of summit, to give us because it is an eye opener to what our roles are as next generation healthcare professionals. So it is not just it is patient-centered care. It is not just about us, because in this part of the world, most times we care about our egos as healthcare workers, or you see the doctor trying to exercise his authority and without thinking about the needs of the patient, or you see the nurse trying to question the orders of certain things and wanting to exercise her own clinical autonomy also. But you realize that there's a disparity in these things, and everybody just cares about their ego without thinking about the needs of the patient, not just the patients, also the family members. So
and yes, and maybe let me ask this. We're talking about patient-centered care, Sharon, but sometimes the patients themselves are very complicated individuals. And in certain contexts, at least in ours, there are patients who go to hospitals and look at nurses as persons who are doing what they're doing because they failed to do what they want to do, so they look down on them. It's a very complicated one. I don't know about Nigeria. How do you still offer patient-centered care to persons as complex as that, even in their very own attitude in approach to the healthcare workers?
Okay, thank you very much for the question. Okay, so I'll say in clinical competence, we almost cannot fault health professionals, especially nurses, but it is in issues like attitude, like the emotional skill, emotional intelligence. That is where people will have a problem, and that is where you want to fault a nurse. But I'll say that the system is one of the contributing factors to this challenge, because you realize that in this system there's a shortage of healthcare professionals, there is overwork, there is burnout. So a lot of factors in the system is not really contributing to patient-centered care in its entirety. So most times patients around in this part of the world, they're not motivated to wanting to come to the hospital. A lot of times the hospital is the last resort for patients. All traditional options must have been exhausted, all spiritual interventions must have been exhausted, and what have you. But then eventually they come to the hospital, not because they want to come to the hospital, and the reason is not far-fetched. You realize that when they come to the hospital, the care that we are giving them, the care that is being given to them is not encouraging enough, is not patient-centered enough. And you realize that these people, they are at a high deficit, and the rate of dissatisfaction is increasingly high, as buttressed in different research studies in Nigeria. The rate of patient satisfaction is very low, and that is one way we as the next generation of healthcare workers, that is one way we can come in to advance the system and change the narrative.